My name is Jeff Kositsky. I'm currently the Director of Advancement at Urban Alchemy, a nonprofit that works in California. Prior to that, I served as the Director of the Healthy Streets Operations Center and was the founding director of San Francisco's Department of Homelessness and Supportive Housing. And prior to all that, I've worked about 25 years before that in affordable housing and on homeless programs, both in the United States as well as Latin America.
Thank you. You spent 3.5 years as the director of San Francisco Department of Homelessness and Supportive Housing, and then 1.5 years as the director of Healthy Streets Operations Center. Can you briefly tell us the biggest achievement and the biggest failure during your tenure there?
Yeah, I mean, I think I can't pick one, but I can pick a few. I mean, I think one of the biggest achievements, frankly, was the creation of the department itself. Prior to that, there were like 4 or 5 different departments with homeless programs in San Francisco. There was no single kind of center of accountability around the issue. But, when I started, there was like 2 or 3 staff people, and I didn't even have a desk to sit in, a chair to sit in on my first day of work. And, 3.5 years later, we had more than 120 people on staff. We had an office, we put an infrastructure together and created a department and developed a strategic plan to address homelessness overall for the first time ever in the city. It unfortunately doesn't get as much attention as it deserves, but it was based on national best practices. A lot of it was rooted in work that was done in Houston, which saw a very significant reduction in homelessness. So I think that in itself was a big achievement. I'd say the other 2 things of note were when HSH started, there were 15 different data systems tracking homeless programs in San Francisco. And we consolidated most of them into one data system and a coordinated entry system. And it's still a work in progress, and its impact is probably just starting to be felt now in terms of its ability to help us address these issues better and to better serve our unhoused neighbors. But I believe that I would say between 85 and 90% of all homeless people in the city are in that system now, and that's a great tool. And lastly, I think I'm proud of the fact that we reversed San Francisco's trend of being from 2005 to 2016. We were if not the worst, if not one of the worst continuums of care, or kind of counties that that's what we call like the homeless. That's the body that brings in federal funding to address homelessness. And a lot of our data that we measure against one another is through the COCs. So we were one of the worst performing large COCs on the West Coast. And in fact, homelessness went down in the US and the Bay Area. At the same time, it went up by over 15% in San Francisco. And we also had doubled our spending during that period. From 2016 to 2019, we actually became one of the best performing COCs on the West Coast. Homelessness still went up. It went up, unfortunately, 18%, I believe, during that time period. But in California, it went up 33%. LA went up 45%, I believe. San Jose went up 48%. Seattle, Portland had double-digit increases, over 20% increases. And Oakland had a nearly 100% increase in homelessness. So we reversed that trend, and I believe that that's going to continue. Our kind of modeling showed an increase. We expected an increase in 2019. It was a little bit bigger than we had predicted, but we also will start to see a decrease, I believe, as a lot of the housing that we started building in 2016 is now just opening up. And a significant amount of new housing will be opening up in the next couple of years. And I'm optimistic that we'll start to see a decline in the numbers.
Thank you for that. And then is there any big failures that you regret about?
Yeah, I think the 2 biggest regrets are, first of all, I want to say the work that I just talked about was not done by me. It was done by a huge team of people, both within HSH and many departments outside of HSH working to get the department up and running. So, but the failures I will own for myself. I think I did not do a good job in leading the department towards finding a way to better support our nonprofit service providers. The one thing I would do if I could go back in time, the one thing I would do differently is really fight for like a 25% increase in all of our service contracts, or at least a way of like leveling out and making them fair. We are asking people to do extremely difficult work, and we're not paying them enough, and that impacts the quality of the work. And I just think it would be an important investment for us to make. And then the other thing I would say that I wish I had done better was when we developed our strategic plan, it was an opportunity to kind of bring people together and create a better culture around this issue in the city. And instead, I would say things stayed the same or maybe got slightly worse just in terms of the constant infighting. I did not do a great job. And I think that's incredibly important, but I also feel like the new director of HSH is already doing a better job than I did on that front. And I'm hopeful that she'll help do some of that work, because this isn't all about money. A lot of it is about, and it's not all about efficiency. It's about those things, but it's also about culture and culture change. And I think the thing that I'm proud about at HSOC was that we went from about 13 or 14, maybe even 1,500 tents that popped up during COVID and completely lost control of our streets. And 9 months later, we were down to under 400 tents, and we placed over 2,000 people into sheltering alternatives and helped a lot of folks get into treatment, and just helped a lot of folks, period. And I didn't really see any things that I would call big failures. I think the work we did at HSOC was a huge success, and bringing together, and I would say, and I also feel like I helped maybe redeem myself for not bringing people together effectively, because HSOC is a collaboration of multiple departments: police, public works, public health, fire department, homeless department, of course, and those departments don't always work together so nicely. And I think at HSOC, we were truly just a team of teams, as they say, and functioned incredibly well. And Sam Dodge, who's taking it over, is continuing to do a great job. And I don't see any major failures. We had a mission and we achieved it. I'm really proud of that work.
Thank you for sharing that. So you mentioned nonprofits, and then some critics may say there is a large industrial complex of nonprofits, both on the East Coast and the West Coast. So how do we balance the usage of nonprofits, and how do we identify the good ones?
Well, I don't like the use of the kind of nonprofit industrial complex. But if we want to talk about like an industry has been created around this issue, of course it has. It's a big issue. It's been around for many years, and that's not the fault of the nonprofits. That's the fault of our societal failures to provide adequate housing and care for everybody. So the government has relied on, the private sector to do all kinds of work because, supposedly we can be more agile, more effective, and frankly, more cost effective. I find it, and I find that this idea, it kind of reminds me of people's concerns about welfare fraud. We need to do all these things to protect us against welfare fraud. And of course, there's some welfare fraud, but it's so minor. What we do to try to prevent it makes the program ineffective. And I think it's the same thing. Like, sure, there's probably some inefficient nonprofits, and sure, there's maybe even some, I haven't come across them, but there may be some ones there's some malfeasance going on at some level in the country. Of course there are, but 99% of these folks are like incredibly hardworking, committed folks. And I don't think, and I frankly get tired of the kind of, beating on these folks. And we talked about this earlier, but I'll say it again now. One of my coworkers, we're not a homeless service provider agency, but one of our coworkers was shot on the streets doing his job just a few days ago. And rather than the outpouring of care and concern for Urban Alchemy and for our worker, we're just getting a lot of like grief over it. And I just feel like that's just so horrible. Like, we don't, the people who do this work deserve to be treated or spoken to this way. But I will say, if there's any failure, it's probably more on the government side. We need to do a better job of, like they say, if you can't count it, it doesn't get done. And we need to do a better job of monitoring our work and making sure nonprofits are doing their work effectively and supporting them when they're not, or finding other providers if they can't do it, reporting to the public on it more effectively. I think we need to, again, pay them more fairly. And then the one thing I would say is that we have to find this balance between economies of scale and efficiency and wanting to fund every program because it's like the new cool thing, or it's or it's addressing a niche problem. So I'd say probably there's too many organizations. That's probably true. I would love to see some consolidation within the sector. I think that would save some money, but I don't think it would save a ton of money. So we have 55 nonprofits right now, roughly, providing homeless services. If we brought it down to 30, and I'm just estimating here, I mean, that would maybe save a few $1 million, like in overlapping overhead costs. Honestly, like, is it really worth it? I don't know. I'm not sure, but I do think we need to get over this like idea that there's something there.
Interesting.
Or that there's some solution there, or we're going to solve the problem.
Right.
If anything, we should be paying these organizations better and treating them the same way we treat for-profit companies who bid on government contracts.
Thank you for sharing that. So some people may say in San Francisco, and then they look at the data, oh, it costs $6,000 per tent, or some outrageous numbers like that. And then, or, there's also the homeless village. I think they're called like tent villages or something like that, or 6 sites around the city. And then it costs more than $2,000 per person per month. And then people may say, in that case, we could just rent them an apartment in San Francisco instead of setting up this tent city. So why does it cost so much?
Well, and I would say, and this goes back to my other failure that you just reminded me of, is and I wouldn't say just in San Francisco, I'd say as an industry, we do such a horrible job of like communicating facts to people. I feel like the whole industry needs like a PR firm to help figure out how to communicate better on the work that we do. Because I think things get spun up in the newspaper, and it's very hard then to combat. We don't do a good job of combating or responding to misinformation. So first of all, let's talk about like what it costs to actually provide permanent supportive housing in San Francisco. And that's housing for homeless people that has on-site support services, which many people, need to stay housed successfully. That costs closer to $3,000 a month. Why does it cost that? Because it's freaking expensive to live here. I mean, and I would like somebody to find me a 1-bedroom apartment in San Francisco for $2,000. Like, good luck. Doesn't exist. That's a unicorn. It's expensive real estate. It's expensive to hire people to work here. I mean, if our energy bills are expensive, our utility bills, garbage, everything, it's expensive. So yes, it's going to cost a lot.
So does that 3,000 include meals and everything?
No, that's just housing and on-site support services. Permanent supportive housing is like somebody's home. Like, it's the same as your home or my home that you might be renting. People have a lease and a key and tenancy rights. It's just for a specific population with on-site services, and it's expensive. That's just, there's no, and frankly, it should be more expensive. We should be able to hire, be able to pay our staff better and hire quality staff to do this incredibly hard work. And as far as the villages go, what happened there was really unfortunate in that particular article, in that they were comparing like apples to oranges, as they say. So that may have been the cost, but what people didn't realize is that was like a point in time cost during the middle of COVID. And Urban Alchemy and other organizations were paying time and a half or even double time to get people to work during COVID. as well we should have. I mean, so it was very, very expensive. That no longer the costs are much lower now. That was, and then you kind of looked at a point in time you looked at a shelter budget, pre-COVID shelter budget, and compared it to the actual costs of running a safe sleeping site. It's not a fair comparison, because all of the shelters also saw increased costs during COVID, because they were also paying their workers, or they should have been paying their workers, hazardous duty pay, which they absolutely deserved. So yeah, it was expensive, but it was for a point in time. And then the other thing you said is that we could just pay people for an apartment. Well, most homeless people absolutely would take an apartment or a hotel room over a tent city, but not everyone. Not everyone. And that's just the reality of it. Is some people weren't ready to be inside for whatever reason. Not the majority. And I'm not trying to create like a stereotype or people. I don't want people to say, that I think homeless people don't want housing. That's not what I think. I think some people get into situations in which, where they're at right now, living in a tent, oftentimes struggling with substance use, in a really chaotic situation, that what they're ready for in that moment, if we want them to move from where they are to somewhere else, a safe sleeping village is a great option for some people. And we have to provide a continuum of services and a variety of services. We need to give people choice. Like, if we want homeless people to not engage in behavior that we don't like, whether the house people don't like, whether it's setting up a tent encampment or whatever it may be, if we want them to change their behavior, we need to provide them with viable alternatives that will lead to that behavioral change. And I think one of the best things you can do is to ask somebody what they want. And that's what we did at HSOC. And we found that some people just wanted to be in their tents. So we created a place for them to do it. And I think and then people would say, like, oh, that's horrible. How could you do that? We can do better. We should do better than that. But guess what? A lot of folks don't want to go into congregate shelter.
So can you give me the top 2 reasons why some folks don't want to go to a shelter, but rather?
I mean, I can tell you what some people have told me. I think the only people who are expert on this are the people who are experiencing homelessness. But I think that there's a couple of reasons. One is people were, living in an encampment, and they were really like caught up in their substance use, and they just needed to be close to their dealer, and they didn't want to go into a place where they weren't going to be able to use safely. And, were worried about their own safety. You're in a hotel room by yourself, and even in housing by yourself, you're safer if you're with somebody else, and you're with a group of people.
In case you overdose.
In case you OD, yep. And other people, their partner wasn't allowed in their building, or they were kicked out of their building, and they just wanted to be together with their partner, and the city didn't have options for them. So being in a tent made sense for them. Other folks, I think, I don't think I heard this articulated exactly this way, but it's the feeling that I got, is that they didn't want to be part of like a government program where they were taking a handout. They just wanted to be left alone and try to make it on their own and find their own way through this. And going into a shelter or housing or an apartment or, was kind of took away their agency and their self-determination in some ways. And they actually wanted to, and having their own tent was like, well, this is mine. And we would say, well, would you do us a favor and just not put it here? Can you put it over here? You can do all the same things you're doing here, and there's no curfew here, and we're not. And as long as you don't hurt other people, there's no rules here. That really works for some people. I'm not saying we should stop having housing or shelter or all these other things. I'm just saying that this is a good tool, and it's a good alternative to some people. And if we want to address these problems, we got to meet people where they are. Our own local coalition on homelessness, in a survey that they did of homeless people, many, many homeless people, showed that I think it was close to 60% of all unsheltered homeless people preferred a tent village over an actual congregate shelter, not over other kinds of housing, but over a shelter. So that's why, and it was expensive in that moment in time because of COVID, and it's not cheap now. But also I want to say, like, none of this should be cheap, because you're dealing with people who have complex needs, who are really traumatized, both probably from their life before becoming homeless and then also during their homelessness. And working with them is challenging. And you need high quality, well-trained staff to do that, and that costs money. And there's people who, write code for, and not that I have anything against coders, but I have people who write code for, work 30 hours a week writing code, and they're microdosing, shrooms or LSD while they're doing it and having a good old time, and they work hard, but they make $250,000, $300,000 a year just doing that. And I'm sorry, but like, working with somebody who's highly traumatized requires, in my opinion, like just as much, if not more skill than that does. So of course, I just don't even like buy into those kinds of arguments.
So what percentage of homeless, unsheltered individuals have a shelter at night, but go back to their tent during the day?
Yeah, excellent question. So, as we found during HSOC, there was every day we would go out, it was anywhere between 10 and 15% of the people who we engaged with were either housed in private housing that they told us about, or we were able to look them up in that data system I spoke about, and to see that they were either that they were housed somewhere, or they had shelter somewhere, or they were in a SIP hotel, or even in a safe sleeping site. And we would identify that, it's a fairly significant number of people. And that was concerning to us, because we felt like, I totally understand why people were doing that. But if you think about it, then it's costing the city, like, on both ends. Like, we're having to try to resolve the situation of, an unsafe encampment in a public thoroughfare, public space. And then we're also paying for them to be, indoors somewhere. And that was really problematic. And we did our best to invite those people to leave their tent and go back to that place. I would say, we were marginally successful at making that happen. And a lot of the reasons are the same, which is probably what you're going to ask me. Substance use, my partner's not allowed in there. So I just come here on the weekends or whatever to be with my partner. Some of it, didn't make much sense. And some people had just severe mental health issues. Like, I remember one particular case of a woman with just really, really severe mental health issues. So she really wasn't making sense. And when she was responding to that, so there were, a variety of reasons. Some of it was community, like, I got this housing, but there's a particular community of people, and I don't even want to talk about like who they are, their ethnicity or anything like that, but there's this like specific group of people, and half of them are housed and the other half are not, but they all want to be together. So the housed people tend to spend half their time with the unhoused people. And then some of it, I would say, is due to restrictive rules that exist in some of these programs, or in some rare cases, like quality issues that existed. So there were a whole variety of reasons, but none of them excuse taking up a space in two places when we don't have enough space for everybody.
So in San Francisco, I know there are rules against sitting in public space during the day, right?
Yep.
So what can agencies like, Department of Homelessness and Housing do to people who are taking public space during the day?
What can they do, or what should they do?
I don't know.
Okay.
What do they do? What do they do?
What do they do?
Yeah.
Well, nothing. They're not. None of those organizations that you mentioned have law enforcement authority. Like,
But what do the
there's
police do? Can the police do something?
the police can do something. They can cite them.
But what does the citation mean?
Well, if you get cited, it's like being arrested, and oftentimes they will cuff you and write you a ticket and give you that ticket, and you can either pay the ticket or appear in court.
Like, it's
And
usually like, I like right now it's just misdemeanor citation or quality of life issue,
Yep.
right? So that's like almost nothing. I don't think anyone is going to show up in court or
no, and
be
then the
really
judges
arrested.
have in the past dismissed it all the tickets. And look, I mean, I do not believe that those laws should, honestly, like sit-lie laws or anti-panhandling laws. I don't believe those should exist. I think they are wrong. And honestly, if I could make up all the laws myself, I would only, and although other cities have this and it hasn't worked, but I just think, yeah, we shouldn't let people set up permanent campgrounds in the city. But I think if people set up tents at night to sleep and we don't have enough places for them to go, that should be fine, as long as they take them down during the day and don't create, like, I think the encampments create huge problems. But outlawing like sleep or sitting is really, in my opinion, wrong. That doesn't mean that I think it's okay for people to create chaos in urban neighborhoods. And I think better responses are social workers or community ambassadors, who are engaging with people in the neighborhood, who get to know people in the neighborhood, and who just are talking to people about the impact of what they're doing on the community. Like, hey, if you go poo in this park, these kids can't play here. Like, come on, don't do that. Like, I get you're struggling. I get you might be a little impaired right now, but there's public restroom 2 blocks away. Please go use that. What is writing that person a ticket? Like, if somebody's gotten to a point in their life where they're pooping in public, I mean, they're in pretty bad shape. People don't like decide they want to poop in public for no real reason. There's probably some substance use or mental health issues going on, and having the cops come down on them isn't really safe. Like, I would rather people who don't have guns deal with this than people who do. And I think unless you are hurting other people or breaking the law, like flagrantly breaking the law, or refusing to like let people travel on a sidewalk or use public spaces, we shouldn't be trying to enforce. I mean, I think if somebody is like blocking my business or my home and doesn't let me come out, no, that's a different thing, or trespassing on my on private property. But somebody just sitting down,
I mean, like the sit down, it's not being enforced at all right now,
no,
right? And then, but the thing is, I mean, I saw this picture of a sidewalk being completely taken over by encampments during the day, and this 5-year-old boy had to walk on the road with
where
his
did you
mom
see
to
that
go to school.
picture?
It was San Francisco Chronicle, I think.
From a long time ago?
No, it was just like more recently. I don't
guarantee you that photo was pre-COVID. That hardly exists anymore in the city. People don't want to realize it, or I mean, not saying that there's no places where there are problems, but no, I agree with you that those need to be removed. That's not okay. Like I said before, it's not okay to have a tent set up that's blocking a sidewalk during the day. You can't have a permanent campsite in a city, anywhere, unless it's in an authorized area. That's just not healthy and not good for anybody. But that's really different from somebody sitting down just to take a load off.
Yeah, I have no problem about
Asking
that
people
either.
for money. So I think 647E, the no lodging law in public spaces, is absolutely can and should be addressed, but using a services first approach, like engaging with people, telling them what's going to happen, giving them like a long lead time. Like, we're not like, don't show up the day of and surprise everybody. Let them know what's coming. And then you offer everybody assistance. That's what we did with HSOC, and that's, I think, works. And I think the other issues should be addressed by like the community saying, hey, this isn't cool. I mean, in some neighborhoods actually do that really well.
So what do they do?
they kind of self-police. Like you'll see like in Bayview, Hunters Point, you know, people know everybody, you know, and they just, you don't see like huge tent encampments down there generally. Sometimes you will in like highly out of the way places, but generally the neighbors are going to be like, no, like don't do that. Like, hey, I know your aunt, you know, she wouldn't want to, or whatever. There's just a community connection, and we need that kind of like just talking to folks and letting them know like, hey, I feel your pain, my friend, and I feel you, but you don't get to, you know, you can't be shooting up right on the street here and throwing your needles down. There's little kids walking down the street. They don't need to see that. They don't need to step on your needles. Like that's not cool. You know, and I think there's things that we just should not be tolerant of. Like, and frankly, I'd rather see us address drug dealing rather than drug use. And
for the drug dealing, like what's going on right now? Does the police do anything to the drug dealers, and who are they?
I'm not an expert on that. I don't even really want to comment on it. You'd have to ask the police.
Oh, right.
Yeah. But obviously what we're doing isn't working. So we really need to up our game and disrupt that. We're not going to stop it. But I think letting it get so concentrated, like I was on a street the other day, and like it was just like insane. I mean, it was the whole, like every person on the sidewalk was either dealing drugs or buying drugs for an entire city block. I'm like, oh my God, like how is that allowed?
And there's no police around, and but you know, are there children around? It's in a neighborhood?
No, they were out of the way.
Okay.
They were out of the way, but it was still like just like it was like going to the supermarket. I mean, you know, it was a big crowd of people.
What did you do?
What did I do?
Yeah.
No, I'm not going to do anything. It's not my job to do anything.
I
don't work for law enforcement, and it's not, you know, Urban Alchemy's job. We're not law enforcement either. It's a, you know, somebody's breaking the law. That's what we have police for.
I see. Yeah.
I'm not for police engaging with people who aren't like breaking serious laws, but you know, 50 people on a block buying and selling drugs, that's not okay.
Yeah.
And I would leave the users alone. I would just arrest all the dealers. But you know, it's complicated, but I think letting it get concentrated and letting it go uninterrupted also creates, and I'm, you know, learning this in my new job, it creates sort of this progression that occurs that's dangerous, in that the more people get used to just being able to do what they want, like the more they'll keep kind of upping their game. Like, oh, you know, I feel this, like, oh, I feel like I want to be a drug dealer. And then they act like a drug dealer. They start dealing drugs. They kind of give into that compulsion to do it. And then they feel satisfied, you know, oh, I'm making money. This is great. And then they get around to the circle again and they're like, oh, I did that. Like, what am I going to do next? And they get it kind of like, and it happens with like violence. Like first we saw the drug dealers in the Tenderloin, like using like bats and sometimes machetes. And then they progressed to knives, and now they're using guns. So I think if you allow this kind of stuff just to be, and I'm not an expert at this, this is just my own observation. If you allow things to kind of just happen uninterrupted, things kind of just spiral downwards.
Right.
And people will say, well, you're not solving the problem by just chasing drug dealers around. And I agree, you're not solving the problem chasing drug dealers around, but you are like managing it better. And like, just because you can't solve the problem doesn't mean you don't try to manage it. You're like, right, just because you can't cure cancer doesn't mean you don't try to address the symptoms of it and try to make that person comfortable. We're not going to say, oh, I'm not curing cancer, so let that person just suffer. No. And we shouldn't say that about our communities either. Yeah, we cannot solve these problems, but we should not allow our neighborhoods to suffer the way that we do without just trying to manage it better. And unfortunately, we get into these debates, these either or debates.
Yeah.
And as you know, I kind of land in the middle on a lot of these issues. We need to do both of those things. We need to do harm reduction, and we need to address kind of the demand side and help people who are struggling with addiction. But we also need to address the supply side with the best that we can. And even if it means just disrupting folks, and, you know, they're not going to go to jail, so why bother doing it? Well, I would say because you're making it harder, and you're keeping people from like just hunkering down on a particular block and just acting so brazenly.
Right.
And that's what I think we could be doing.
Thank you for that. So based on your experience, like roughly what percentage of unsheltered homeless individuals are from out of the city?
Yeah, it's hard to know. And so the official data would tell you that about 30% of unsheltered people come from out of San Francisco County. And that's done through the point in time count every 2 years. Actually, it was just the point in time count just began last night, I believe. We skipped a couple of years because of COVID. But there's also a survey that's done with about 1,000 people after the point in time count is done. And we ask people that question. We don't verify it. It's self-reported data. I don't believe that data is actually very accurate, and wish that we spent more time actually figuring this out. My guess is over half of that at least 50% of the unsheltered population, people like you see in tents and sleeping out. I would say, let me take that back. I would say at least 50% of the people in tents who I spent a year and a half or a year engaging with every day when I was at HSUC are not from San Francisco.
Thank you for that.
Yeah, so if you break it down, it's kind of interesting, right? It's 50% of the people aren't from here.
Right. So why are they why do they travel?
Yep.
I mean, some people say they travel to San Francisco because the city gives out cash assistance.
No,
and some other people say because there are
true.
more drugs. So like
it's not because of services. I think we used to have our GA rates, general assistance for single adults rates, were higher than other counties, but every county has GA, and ours is quite low. Right, through the Care Not Cash program, you don't get a lot of money. You can get access to a shelter or housing, but we don't. It's not a ton of money. And I don't think people come here for services either. I mean, and again, not everybody. Some people do. Some people might come here for money. Some people might come here for services. I think most people who are coming from out of county into San Francisco are coming for, you know, one of three reasons. One is they've got some kind of family or friend connection here, you know, from a previous life or whatever. I think some people are coming here for the same reason that I came here in 1989, is just looking for a culture and an environment that was more conducive towards my lifestyle than where I grew up. But I think a lot of people are coming here seeking drugs. It's easy to get here. It's inexpensive. And so it's hard to like kind of just pin it down, but I do think a lot of people are coming here from out of county. We saw right after COVID, a whole group of people from the same county show up in San Francisco. Our understanding is they were released from jail and they all decided to come to San Francisco. And then we also saw a whole bunch of people in RVs showing up asking where their hotel was, like during COVID. So Mayor Breed very wisely set a policy that if you couldn't prove you were in San Francisco prior to April 1st, you could not get into a SIP hotel. And frankly, a lot of people left. So I think you have to, saying that it's not a problem and that only 30% of the people come from somewhere else is not smart, and it doesn't really address the reality of what really happens. But saying it's a huge problem, that, you know, that it is the problem is also false. It is a thing that needs to be addressed. And I thought Mayor Breed, at least in that case, addressed it very, very wisely. It shouldn't be our whole focus. It should be a focus. Like, you know, and I think and honestly, I think it's a lot of it is government to government discussions. which we were working on improving, because a lot of hospitals in certain counties that I will not name discharge their patients to shelters in San Francisco. Like people would show up in a Lyft or an Uber with a hospital band on from a hospital in an East Bay county, and were told to go to one of our shelters. And during COVID, that shelter was closed, and they just kept doing it.
Wow.
Yeah.
That's crazy. Yeah.
Yes.
So yeah.
But I would say the city and the city attorney like addresses that when it happens. But pretending it's not a problem is not cool. It's a thing that needs to get worked on that we could do better at. And also, I do think that if we made it harder for people to buy drugs in San Francisco, there would be some improvement in that number.
So I have like time for 2 more questions
Sure.
here, even though I have like many more. So some people may say homelessness is not about mental illness and drug addiction. Would you agree with that?
No, I mean, I don't think, and nor would I agree with people who say that the only solution to homelessness is permanent supportive housing for everybody who's homeless. It's a complicated problem. I think there's a huge like range of people. There's some people that we can help with one-time assistance, you know, a bus ticket home or help with a security deposit. There's some people who may just need 6 months or a year of rental assistance. And there's absolutely many people who need permanent supportive housing, which is a very effective tool, but it's not the only tool. There's like a range of like housing first programs that we have to look at. And again, San Francisco, unfortunately, we tend to think that's just permanent supportive housing, but it's not. Housing first can be a wide range of things, just like harm reduction can be a wide range of things. But, and I think the solution ultimately is finding housing for people, but to ignore the role that the impact of untreated mental health and substance use disorders have in this problem is to just ignore reality. I don't think drugs and mental health are the driver, like the reasons why people become homeless. I think that has much more to do with housing costs and housing situations and societal issues like institutionalized racism and income inequality and and how those things have impacted families, especially communities of color. But there's so much untreated mental health and substance use on the streets, and it is a barrier to people. Well, it's a barrier. First of all, it creates unhealthy behaviors on the streets, and it leads people to do things that they probably wouldn't normally do. People who become really addicted become very self-centered because the addiction is, you know, is controlling their lives. And some folks are so sick that like that they're in crisis like all the time. You're not just going to put them into housing. So it's not one or the other. And again, it's this whole like, yeah, for some people it has nothing. I think for most people, it's not why they're homeless, but I think for over half of the people, it's a serious who are unhoused. I think it's a serious problem that needs to be addressed and is a barrier to us solving homelessness and the impacts that it has on our community. Again, everybody's trying to argue a position on this issue. And I think even people who say that, I think they know it's fundamentally not true. I think they're just trying to argue for housing-based solutions. And I applaud them for advocating for that. I think that's what I tend to think is the most important thing. But to say mental illness and substance use, you either are being political and too manipulative in your communications, or you don't work on the streets. I mean, it's one or the other. Either don't know what you're talking about, or you are not wanting to say it because it would have potentially negative consequences on policy decisions that get made. And I don't abide either. Those are poor excuses on such a complicated problem that affects so many people. Like if we can't be honest and just say the truth and use data and common sense and our eyeballs, we are never going to solve this problem.
So my last question, so you mentioned housing first.
Yep.
And we all know to build permanent supportive housing, it's very expensive, first of all, and it takes a long time. So do you think in San Francisco and LA, the focus on building permanent supportive housing is crowding out resources for shelters and interim housing?
No, not really. So, I mean, when I was at HSH, both Mayor Lee and then Mayor Breed invested a lot of money in creating new shelter. And then if you don't invest in housing exits, and again, it doesn't have to be permanent supportive housing, but kind of the rule of thumb, and I don't know how good of a rule of thumb this is that for every shelter bed that you build, you should have at least 3 like exits from homelessness. And it could be, you know, long-term permanent supportive housing or shorter term interventions or one-time interventions. Like you have to like manage, otherwise you're just putting a bunch of people in shelter and they're just going to stay there. I do believe we need more shelter, but I think it can't be this or that. It needs to be this and that. Yeah. I think really what happened, to be honest with you, like that's the other thing that people don't realize is that policy decisions that people make that are based on feelings and opposed to data have really long-term impacts that don't get seen for years because this stuff is slow. It takes years to develop permanent supportive housing. So back in 2002 or 2004, I can't remember which, then Mayor Newsom said, we are no longer going to build homeless shelters. We're going to put all of our money in permanent supportive housing. And I, amongst many, like applauded that. I'm like, yes, let's focus on the solutions. But what we all failed to think about, you know, like in the 10-year plan to end chronic homelessness, they're like, well, there was 2,000 chronically homeless people, so let's build 2,000 units of permanent supportive housing. Well, that's smart, but nobody thought about the inflow. So you kind of got to look at the numbers, and I think HSH does a great job of doing that with our, you know, really great data team. And this stuff takes time. So I think what Mayor Lee and especially Mayor Breed did was it course corrected. So you've got, you know, between 2002 and 2015, like hardly any shelters got opened. And we course corrected in 2016, but we're doing it in a balanced way. I do think when you've got measures like Prop C that dictate like how the money is supposed to be spent, that's really problematic because really what the city needs is to be able to use data, both look at past data and develop predictive models, which, you know, isn't that hard to do. We kind of do it to figure out like trends and like where there's gaps in the system, and then make some public policy decisions in the light of day with everybody listening and watching. Like, what do we care about as a community? And then let's figure out how to use these resources the best way that we can. And I agree with folks who feel like we need more shelter, but I don't agree that it's because we're investing in housing, we can't build more shelter. I just think we made bad policy choices 10 years ago and more than 10 years ago, and they're coming home to roost. And HSH, my colleagues and I recognized that like right away in 2016, and we made moves to correct that. That's what it's going to take. There's no magic solution. It's just hard work, and these kind of this against that debates, or the other thing that drives me nuts is the, you know, the new shiny object, you know, that gets so much attention: navigation centers, safe sleeping villages, blah 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 blah. The new team, the, you know, the hot team, the SCRT team, the HSOC team. Those are all great, but it all has to work together as a system. And it needs to be data driven. And that's what places like Houston have done really successfully, and other communities as well. That's what San Francisco is on the path towards doing. But it's always going to be harder here because our vacancy rate's super low and our housing is super expensive and our labor costs are really high. Like Houston just grows like half a mile every year. I mean, there's just housing constantly being built. Yeah. So it was a lot easier and a lot cheaper. And they don't have the same zoning laws that we do, and which is a whole other discussion. So, but the best we can do, you know, is the best, you know, and we can't solve this all by ourselves as a city. But I think what we can do is just keep using data, keep using common sense, get the politics out of it, and just do what the experts say need to get done. Which is also why, like, I am optimistic because I feel like HSH was always on the right path. It was, we kind of got sidetracked all the time, and it certainly wasn't linear. But I think we'll get there. And we certainly have more money now. They have more money now, and so I think we'll make some progress. But it takes a lot of time, and people have to be patient. But my fear is always, well, it's not my fear, it's the reality I dealt with for 5 years working for the city. People get impatient and expect immediate results, and then we get knocked off track. Or other people come in with ballot measures or legislation. I spent so much time fighting off bad ideas. And some supervisors were great about listening and debating in a positive and sometimes public, sometimes private way, and then adjusting, and that was great. And others were just, no, like, you're wrong, you suck, I hate the mayor, I hate you, your programs are bad, you're evil, I'm going to fight everything you're doing. And then it didn't really stop us, but it slowed things to a halt, and it took up an incredible amount of intellectual and emotional energy and time. And that's a problem, and we need to stop that crap. But I'm not optimistic about. But I think it's going to take a while, but I think 5 years from now, we'll be in a better place than we are today.
That's great to hear. Well, thank you so much, Jeff, for speaking with me today. Thank you.
Absolutely. And hopefully we will continue to be in touch.
Yeah, definitely.
All right. Have a good rest of your day.